Q&A, we talked a lot about scar taping after cesarean birth, and this is particularly helpful if you happen to have a scar that's red and raised. You know what else can be really helpful? Scar massage and movements. These things are so impactful with your cesarean recovery, especially if you're within the first 6 months postpartum. This can help you big time with scar pain, core weakness, scar appearance, and so many other things. And you can make a huge change in these things in just 5 minutes. So make sure you join me for my workshop tomorrow, which is Tuesday. Here's what's going to be happening and why this workshop is so exciting. This is a mini workshop, which is like a summary of my 1-year-long cesarean birth programs. Okay, it includes a $49 coupon towards those programs. It includes an exclusive discount to Scar Tape by Spider Tech Tape. It also includes a prize package to Scar Tape, so your chance to win. And it's also covered by your athletic therapy benefits. So pretty darn good workshop, and you're worth it. Let's make sure that you get started on your recovery today. The C-section shelf has many causes, and at 7 months postpartum, if you haven't tried any scar massage, that'd be a great place to start. But I'm going to link my free resource below about the different causes of the C-section shelf. Best to figure out what the cause is for you and then follow that specific strategy. Scar tissue is living and breathing. It is always reacting to the loads that we put on it. So it turns red or purple, or it's discolored when it's got more load that it can handle. I actually talk a lot about this in my Instagram live today, so make sure you tune in. It's all saved on my grid, so take a look. Now, every brand is different, and I happen to like using the Scar Tape by Spider Tech Tape. So they have a different recommendation than what I recommend to my athletes. So the way I recommend it is you put a new piece of tape on every single week, but you only leave it on for 6 days max, and you take it off for 1 day. I think it's important for the skin to breathe and to heal, especially it's a tummy area. It's really sensitive. It's sweaty. It's dark, and it's healing. You don't want to leave something sticky on for too long. Now, here's what you can expect. With every single piece of tape that you use, the redness will decrease, the raised sections will decrease. So basically, you can use as many pieces of tape in as many weeks as you desire until your desired outcome is achieved. There are so many scar tapes out there on the market, and I am going to be transparent. I am collaborating with Spider Tech Tape and their scar tape because I think it is very effective. It is made of cotton. It has sensitive adhesive. The way that it stretches allows for up and down mobility, but not too much. So it protects the scar as it's healing. And I have personally tried it on my own scars first before I've recommended it. So a lot of my athletes use it, and you can take a look at it in the link below. This is actually not the same as icing or putting heat directly on or around the incision itself. This is called ambient increase or decrease in temperature. You want to actually do that on the skin. So desensitization happens on the skin level. So icing directly or hot cold directly on that skin makes the difference. In short, no. Heat, it will increase inflammation. So in this situation, when you are surgical, there's actually inflammation happening. You want to decrease the pain caused by inflammation, which is achieved by ice. Heat packs are helpful for things like chronic pain when there's no inflammation happening in the area. So many things. Step 1, Go through your birth experience, because the psychology of healing is always first before you start scar massage. In terms of scar massage, don't do direct stuff just yet, but desensitization is helpful. Arm movements are helpful. Getting back into pain-free walking really slowly and gently is helpful. Think about things with abdominal compression. So please think of ab wraps or compression garments, and then you're going to slowly get into scar massage and movements. So the best way to kind of organize this and to flow through with a smooth progression is to take a look at a cesarean recovery program. I happen to have two, but make sure you follow one. It's never too late to start with exercising. If you're about to have a cesarean, it's always best to go into surgery as strong as possible. So if you haven't begun, ABCs is a great place to start. Alignment, breathing, core control, continue breathing, do exercises that help to down-regulate your nervous system. This is a busy time for you. You're about to welcome a third child, so take it easy and set up your birth preparation focus instead. If you're 7 months post and you've never done scar massage, try it out. I mean, you could be very surprised at how quick the improvement is in terms of your numbness, your pain, your core control, and maybe even your appearance. So usually I would say at the 7-month postpartum mark to get a one-on-one assessment just to make sure that you're choosing the right types of scar massage.